Medical decision-making is a partnership, where medical expertise meets patient values and interests. Together, providers and patients work toward care options that truly benefit each individual patient. Every patient brings their own health conditions, values, and life circumstances. It is the responsibility of medical providers, with their specialized knowledge, to determine the reasonable scope of medical options that fit within those realities. But sometimes, challenges emerge. Especially in critical care, providers may believe that the decisions made by patients or families will lead to what sometimes are called futile, but probably are best understood as medically inappropriate, treatments. Imagine a geriatric patient with severe dementia whose family insists on a feeding tube, or a patient with heart failure whose advance directive demands all intensive measures, or even a young child with brain injury whose parents hope for recovery through aggressive interventions. In these and other similar cases, providers may say something like, "The family insists on futile care," or "We feel like the patient is suffering." Families, meanwhile, may say, "Our loved one is a fighter," or "We can't be the ones to let them die." In these moments, providers must carefully consider not only what they believe is best, but the full scope of reasonable, if not always optimal, medical options. Of course, the provider's own biases can creep in, so collaboration with colleagues and ethicists is essential. Disagreements can arise for many reasons. Providers haven't always clearly defined reasonable care. Providers may fail to engage with families. Families, on the other hand, may choose suboptimal but still reasonable options. Families may choose options that cannot work. Families might choose options unlikely to benefit the patient, and families choose options that, in the provider's estimate, will actually cause harm. Of course, each of these situations can cause distress, but whether or not they are problematic needs careful consideration. In 2015, a multi-society professional task force clarified terms and concepts to help understand where challenges lie. They defined and distinguished two important concepts that often get confused in these cases. They defined futility, and they defined potentially medically inappropriate treatment. Futile care they defined as an intervention that cannot achieve its physiologic goal, like antibiotics for a viral infection. Such interventions should never be offered. But most cases are not truly futile in this way. Instead, they are potentially medically inappropriate. They are treatments that may not benefit the patient, or worse, may in fact cause harm. Because judgments regarding appropriateness of medical options and whether or not the options are beneficial are complex judgments prone to bias, the task force recommended a structured process for resolving any conflicts among providers and between providers and patients and families. They said you should consult with experts, seek an ethics review, involve an outside provider, and bring the case to a multidisciplinary committee. It is important to recognize that consensus could go the way of supporting the patient or family's request as not being medically inappropriate, and thus the team should provide the care requested. Either way, it is important to continue good, professional, caring communication among all parties. By running through each step in the process, consensus may be reached, and if the consensus deems a treatment to be inappropriate, providers may refuse it. Of course, even in such cases, families must always be offered a second opinion or transfer. And whether or not consensus is reached, individual providers have the right to step away from care of a patient based on their conscience claims. In the end, most medical decisions are collaborative and smooth, but when conflicts arise, distinguishing between futile and potentially inappropriate medical treatments and following fair processes all help ensure that decisions honor both medical integrity and patient values. Working through situations deemed medically inappropriate by a provider doesn't happen in a vacuum. These decisions unfold within the framework of laws and institutional policies. In Arkansas, the Healthcare Decisions Act provides specific language on these matters. But before turning to state law, healthcare professionals should first look to their institution's policies. These policies often mirror statutory language and may go farther, outlining detailed processes and procedures to ensure that any claim of medically inappropriate care is carefully reviewed. The Arkansas Healthcare Decisions Act states, "A healthcare provider or institution may decline to comply with an individual instruction or healthcare decision that requires medically inappropriate healthcare, or healthcare contrary to generally accepted healthcare standards applicable to the provider or institution." It's important to note that that is all the statute says. It does not define what counts as medically inappropriate healthcare. This lack of clarity leaves room for interpretation and potential conflict. That is why, much like the recommendations of the Multi-Society Task Force, careful deliberation procedures and oversight are essential. Before deciding not to provide a requested treatment, providers should seek review, consultation, and institutional support to ensure the decision is fair, unbiased, and ethically sound. So, while Arkansas law offers some protection for providers, the responsibility lies in combining legal guidance, institutional policy, and ethical deliberation to navigate these difficult situations with care and integrity. Any provider's claim of medically inappropriate treatment must follow established procedures before any action is taken by the healthcare team. At both the University of Arkansas for Medical Sciences and Arkansas Children's Hospital, policies exist to guide these difficult situations. Often referred to as redirection of care, the official policies are titled Futile and Medically Inappropriate Care. We will not spell out every detail of these policies here, because policies can and do change over time. What matters is that they define key terms like futility and medically inappropriate treatment, drawing on the work of a Multi-Society Task Force paper from 2015. These policies also outline procedures that reflect many of the components already discussed, ensuring that any claim of medically inappropriate care is carefully reviewed, supported, or rejected through a structured process. You will see a snapshot of the current procedures on your screen, but we strongly recommend reviewing the most up-to-date policy directly. It provides more detail and may have changed since this video was last updated. In short, policies like these ensure that decisions about medically inappropriate treatment are not made in isolation, but through a fair, transparent, and carefully guided process.